Physiological factor affecting on serum or plasma protein. The first one is patient age, and the second one the reproductive stage. As you know, at birth, the newborn is based on the amount of protein, I mean immunoglobulin, that get it from mother by colostrum. So it's based what the amount of albumin that get it from mother by ingestion of colostrum. In 6 months of year, the age are usually reached to the adult level of protein. Also, after post vaccination, maybe there is a slightly elevation in the level of immunoglobulin, or I mean in protein. And the second one, the protective state, during the gestation and lactation, there is decrease in plasma protein. It is coming due to the decrease in albumin level. There is some interruption of the abnormal value of protein. For example, we have two different types, hyperproteinemia and hypoproteinemia. Hyperproteinemia, which is mean increase in the level of protein, and hypoproteinemia, it's mean decrease in the level of a protein. So hyperproteinemia protein, we can observe it in shock and dehydration and neoplasma. The hypoproteinemia decrease in the level of, we can observe it in maldigestion or malabsorption or during starvation, and when they get pain, or during the lactation, renal disease, liver disease, pregnancy, parasitic disease, and during diarrhea and dysentery. Hypoalbuminemia, there's some places when the level of albumin is going down. The first one is primary and renal in origin, and a low albumin can also seen in conjunction with low globulin. So if there is decrease in globulin, they combine with the decrease in albumin. Also, we can see decrease in the level of albumin during the decrease in liver function. The second state is hypoglobulinemia, is occurred due to currently with the loss of albumin, for example, hemorrhage or third space loss, and protein also losing enteropathy causes. Also, we see decrease in albumin production is usually associated with compromised animals, such as fowl with the failure of passive transfer or inherited immunodeficiency. Hyperglobulinemia, we can get evaluate of globulin within normal or decrease is often associated with the immune stimulation or antigenic stimulation. The high level may be indicate the infection of an inflammatory disease or immune disorder. And also fibrinogen is acute phase protein, so is expected to increase greater as a part of an inflammation response. The elevation of fibrinogen can be result during the inflammation or dehydration. The color them Now I will talk about the minerals. For example, calcium and phosphor are two minerals which are important for diagnosis in all species, whereas magnesium and copper and cobalt and selenium are only important in ruminants. Sorry. The minerals are important in maintenance of electrical activity